I've worn glasses since I was 16. Of course you get used to them, but there are so many times when I wish I had perfect vision without them, like being on the beach with the family. I never really got on with contact lenses. I used to wear them to play sport when I was younger, but you can't wear them in water. And that's a bit of a problem when excited children want Dad to teach them how to swim in the sea or play games on a crowded beach. With vision like this, it's not easy. That's why I decided it was time to do something about it. I always thought that laser eye surgery was too risky, but there have been huge advances in recent years, and with the help of independent websites like this, it's easy to research the best surgeons and clinics. One of the first things I discovered is that biggest is not always best. Most feedback on this site is from very happy people, but it is noticeable that most of the bad experiences are from people who went to a high street branch of a big company. For example, this person says he was in agony for many days after the surgery, but most alarming are the people who say their sight is worse than before. Dean Grandy is another patient who had a bad experience. Like me, he wanted to be more active with his 3 children, and he's a keen yachtsman. He used a high street firm last October, but soon after, things went wrong.
I basically couldn't open my eyes for the next 3 days. I had to physically keep my eyes shut at all times because it was a very, very uncomfortable feeling. My eyes were very sensitive to light, particularly, and the pain. It was an excruciating pain.
In hindsight, would you do it again?
No, I think anybody going forward for laser treatment has to think long and hard about what they're entering into.
But James Glanville had a very different experience when he had his eyes done a couple of years ago. He says the results have been better than expected.
After the operation, if you speak to my wife, she'll tell you that I was like a child, because it was very much, my God, I can see this, can you see that? So instantaneously you could see that there was a huge difference. But 24 hours later, after the operation, was just 20/20 vision, which for me was like a miracle.
So it's made a huge difference to your life?
Massive. It's changed all aspects of my life.
No regrets at all?
No, none whatsoever. I'd do it again tomorrow morning.
James used a Harley Street practice called Advanced Vision Care, and my research also showed that their record is exceptional. Their local agent is Classic Eyes in Bournemouth, where a simple eye test will hopefully confirm that I'm suitable for laser eye surgery.
I think the people who benefit most are those who lead very active lifestyles, who do water sports, perhaps people like yourself who are in front of a camera, where glasses or lenses are not always a good option.
The eye test results are analysed by Lucy, a visiting clinician from Advanced Vision Care, and the news is good. She recommends a procedure called LASIK wavefront, which is a combination of microsurgery and laser treatment.
During the procedure, a microkeratome is going to be used to cut a flap into the cornea. Okay, the cornea will then be lifted open to expose the tissue underneath. That's when the laser will be used. The laser will be pre-programmed to vaporise the correct amount of corneal tissue. Okay, once that's been done, the flap is then gently put back into place, and we put a protective contact lens over the top. OFL.
Lucy does stress that as with any surgery there are risks, although I'm assured that the surgeon, Mr Pillai, has done more than 15,000 of these procedures and that more than 99% of his patients are extremely happy with the results. It's a big step deciding whether to have laser eye vision, and a major part of that is feeling confident about the surgeon you choose. Well, I think I've made the right choice, and so I'm booked in and looking forward to a life without these. So now it's the day before my operation, which is taking place in London's Harley Street, and for the first time I'm meeting the man who'll do the job.
Hi, good afternoon, Richard, Mr Pillai.
Nice to meet you at last. This is my wife Deborah.
Hi, nice to meet you. Come this way, please. Okay.
C.T. Pillai is a world authority on laser eye surgery. He's done 15,000 procedures. But first I'm examined by optometrist Gareth Patterson. Gareth is producing a detailed map of the surface of my eyes in preparation for surgery, and this machine is measuring the amount of light distortion that I'm currently experiencing. How different is this system compared to, say, 5 or 6 years ago?
the difference is astronomical. The degree of accuracy I can map a patient's eye to allows us to remove what halo and glare they have now. In actual fact, patients we treated 5 years ago might actually benefit from having this treatment, whereas they might not be able to drive at the moment. This could help them.
Once Gareth's tests are completed, Mr. Pillai shows me where the operation will take place tomorrow morning. Next, a double check that my eyes are healthy and that the prescription is accurate.
The cornea is quite thick.
Mr. Pillai is satisfied that I'm a good candidate for laser eye surgery, and he says the latest technology means the prospects are excellent.
The present lasers are much more safer, and the wavefront technology is much more, better and beneficial to the patient, and that is why the confidence of the patients, has improved over the period of few years. Okay, Richard. Okay, just relax. We'll talk you through everything. Okay, nothing to worry.
The whole operation will take less than 30 minutes for both eyes. After the anaesthetic, the lid guard is put in place.
This supports the eyelids and prevents you from blinking throughout the procedure.
Next, a vacuum to raise the cornea.
This is the most important part, so you must stay nice and still. Your vision will go a little bit dark, but that's normal.
Mr. Pillai now makes the incision.
Even it is uncomfortable, just for a minute, just bear with me, sir. Focus right now.
The flap is carefully pulled back and the very short laser process begins.
Keep looking at that. You not going to feel anything at all, okay? Excellent.
The flap is then replaced and finally a bandage contact lens covers the
Everything
cornea.
went very well, sir, okay? Both eyes, good flap, good treatment. Did very well, okay? Excellent.
Yes.
Well, I can see a lot better. It's blurry.
Yeah. But that will settle down over the couple of hours, okay?
Yeah.
You'll be able to see things much better in a couple of hours' time, okay?
You've then got some
Next were the important instructions about using my 3 sets of eye drops.
4 times a day for a week.
Then another test.
KV.
Incredibly, my sight is already to the legal driving standard and will improve over the next few hours and days.
Is this a normal standard for this particular time after the procedure?
I think it's more than normal standard. It's more than normal standard. People recover anything between probably 70 to 90%.
This time tomorrow then, what sort of vision should I have?
You should be seeing this and probably 2 lines better with clarity.
Although my vision is at driving standard, it's not advisable so soon after the operation. That's why it's important to take someone with you. Well, it's now 3 hours since the operation and I can feel the anaesthetic is starting to wear off a little bit. My eyes are starting to ache, but certainly the sunglasses are helping quite a bit with the glare. But what I'm most pleased about is the standard of my vision has improved significantly. I am seeing things a lot sharper already. 3 days later, I'm back at work, and for the first time I'm seeing what happened to me.
Right, now this is a suction. Again, you must stay very still.
So far I've had no pain and not suffered very much sensitivity to light. The vision in my right eye is perfect, crystal clear, but my left eye is not quite so good. My 7-day checkup is back at Classic Eyes in Bournemouth.
TZVF.
Very good.
And I'm relieved to hear that all is well.
If someone were to come for an eye examination with a prescription like that, it would be very, very unlikely that they would need glasses. And you've got 20/20 vision, both with and without that little correction.
And is that likely to improve even further over the coming weeks, months?
Well, it will. As your eyes settle down some more and as the dryness gets better and better, you'll find that the vision is a lot more stable, a lot more comfortable, and certainly more clear as well, particularly at night time.
Well, with such good results after just 1 week, it looks like this was the right decision for me. And I can't help thinking that because the process was so fast and so painless, that one day this will be the normal way to treat short and long-sighted vision.